we've got Julia up next. Julia is our Principal Policy Officer with New South Wales Health, Climate Risk and Net Zero Unit. Julia has extensive experience in health policy, including health technology assessment. Before her current role at New South Wales Health, Julia has worked for Greener NHS, where she launched the first net zero small business research initiative healthcare competition and led the publication of the NHS England and the UK Health Security Agency Climate Change Adaptation Report. This is a wide amount of experience, Julia. I'm really looking forward to what you've got to say today. Please welcome to South Metro. Please welcome Julia.
Thank you so much. And I'm also going to share my slides. So thank you very much, everybody, for having me. It's really exciting to be here. I am following on from the theme, which is around the kind of clinical side of reducing emissions. So I work for the Climate Risk and Net Zero Unit, and we are really kind of coordinating New South Wales Health response to our net zero targets, as well as really starting to drive forward that the changes in models of care and clinical transformation that we require. So when we are undertaking this very vast program of work, I wanted to really emphasize the three principles of sustainable healthcare that we are abiding by. And a lot of these, at least the first two, are things that I think we've been doing in healthcare for many years. So, the first one, keeping people healthy, well, and independent, that really aligns with a lot of those public and population health initiatives that we've been doing around obesity, as well as eating healthy and reducing smoking and tobacco consumption as well. And so obviously when we keep people healthy, well, and independent, we keep them out of hospital, and therefore we're reducing emissions from their hospital care. Second is about minimizing that low value and harmful care. And so in my first roles in health policy, I was working in health technology assessment, which was really looking at those evidence reviews of emerging technologies and making sure that they were improving patient outcomes, were of a high value, and of course not causing any harms to patients. But similarly, by minimizing low value harmful care, that might also look like reducing unnecessary tests as well. And of course, decarbonizing high value care. So reviewing the current pathways that we have, and just seeing where can we improve efficiencies, how can we reduce emissions from the products and services that we provide. So to do so, we recognise that a lot of this needs to be driven by our clinicians. And so in New South Wales Health, we've launched the first Net Zero Leads program in Australia. And so that we have 10 clinicians across multiple specialties. But we've also seen similar programs emerge in other local health districts, such as Northern Sydney Local Health District. And what these leads really do is act as change agents, start to figure out how can we redesign those models of care, and what actions can we take in kind of each area of specialty. It's been a fantastic program so far. So we did an expression of interest, and we have a range of clinicians from regional and metropolitan hospitals. I think some of the learnings have been around making sure that we have all specialties really pushing forward. So for instance, we'd love to have a pathology specialty, but also maternity and obstetrics as well. So thinking about how do we, if we were to expand the program, what would that look like? But also small things like thinking about research ethics approvals early on, because we all know that they can be quite difficult to navigate. But let's not. I'm not a net zero lead, and so I would love to be able to share some videos from our net zero leads now.
Hello, my name is Brian O'Connell, and I am the net zero lead for emergency departments in New South Wales. I work as an emergency physician in the COFS clinical network, and I'm also funded in the role of the sustainable healthcare clinical lead for the Mid North Coast. I've been working as a net zero lead since September 22, and I collaborate with the Climate Risk and Net Zero team and the 9 other net zero leads across the state. We have identified and established high-yield programs that will drive our systemic transformation to sustainable healthcare across New South Wales Health. We lead on-the-ground, practice-changing programs that deliver low-carbon, high-value care for our patients. I am the research and project lead for the Rational Investigations Programme, which was launched on the 1st of July in the Coffs Harbour Emergency Department and Hospital, with a plan to roll out across other New South Wales sites in a phased approach. The RIP is a quality improvement initiative which is based on the highly successful foundational programmes such as a Sensible Test Ordering Project, also known as STOP, Choosing Wisely, and other New South Wales, Victorian and Queensland programmes. As an example, a cumulative $1.57 million was saved in 1 year in 3 of these foundational pilots located in a large ED, a large ICU and a small hospital throughout New South Wales. Over $3.9 billion is spent on pathology testing in Australia every year. There are other reasons why the RIP is valuable. We know that over-testing can cause serious patient harm and downstream consequences. Approximately 12 to 44% of pathology tests are not clinically indicated. From a population perspective, the over 85-year-olds is projected to increase by 140% in the next 18 years. So we need to act, and we are. Our goal with the Rational Investigations Programme is to reduce unnecessary pathology testing by 20% of total volume. This is a collaborative nursing and medical programme which includes senior staff meetings, engagement and rollout of educational sessions and multimedia to help staff leading this frontline change in practice. We are working with 5 researchers in the University of Sydney and New South Wales Health Pathology with data collection, analysis and a goal to publish the evaluation of the Rational Investigations Programme. So it is very rewarding to work in this practical, patient-centred and high-value care programme. If implemented across New South Wales emergency departments and hospitals, this will save tens of millions of healthcare dollars. It will decrease low-value care and it will help drive decarbonisation of healthcare systems, which we know contribute to a huge 7% of our national greenhouse gas emissions, as I'm sure you know. So thank you to New South Wales Health for investing in our frontline staff to innovate and accelerate our transition to sustainable healthcare. Thank you.
What's the most important thing about getting your leads in there? What have you seen the biggest benefit?
So it's really about driving action forward and recognizing that every specialty, there's action that you can take in every specialty. So for instance, we know that surgery is one of the largest emitters of waste in hospitals. And so it's about understanding what are those opportunities, but also what are the barriers to measuring, waste or auditing waste, and how can we come up with innovative approaches to actually overcoming those barriers. For instance, something as simple as instead of having to measure the waste as it's going out, you actually look at the waste, the products before you go in. So kind of taking that forward look, and then at the end of the day saying, okay, well, we've used X amount of product, therefore we know that we will have, we will have X amount of waste. So rather than having to kind of dig through rubbish and figure out exactly what we're disposing of, kind of do it in another way. So that's one aspect. I think also that building that research and evidence base as well. I think that's really imperative. I think this is really an emerging area of research globally, but also in Australia. And I think the projects that our Net Zero leads are doing will allow us to actually start to understand, what changes can be made and what is the evidence behind it, both from, a financial, but also patient outcomes and staff experience as well.
Beautiful, Julia. One more thing, you've got some great clinicians there from a wide areas of specialty. How do you agree on your priorities?
So
what's it like in the huddle and saying, all right, we're going to, because there's so much work to do. What are we going to do first?
Yeah, exactly. I mean, I think so. We do have an academic partner we've been working very closely with, who have started to advise the the Net Zero leads on their project. And I think they've been a fantastic help in helping them to prioritise those areas of interest. But also, I know Kate Charlesworth, so she's our director. She does a fantastic job as well, helping them to prioritise. So, yeah, it's great.
Can I just ask you, if you were to think about looking back in your career, and it's been all over the place, what thing are you most proud of?
I think it would probably be, it's hard, it'd probably be something in the greener NHS. I think maybe the launch of the adaptation report. So I was able to use kind of so much experience. So I started out as an emergency nurse, and I remember saying, when I started at greener NHS, you know, I've seen all of these severe weather events and the impacts that they're having on patients, and to actually be able to write this report and working with UK Health Security Agency to actually understand what are the challenges that we face from both a population public health aspect, but also from service delivery, and how can we continue to provide services despite severe weather events. I think that was, really exciting.
Oh, fantastic. I think you can't imagine what it would have been like to make some monumental progress at that time.
Yeah, exactly. It was right in the middle of COVID as well. So
absolutely. Congratulations, Julia. Thank you so much. Thank you for your time and sharing your stories. And
thank you so much for having me.
Could you please join us in giving Julia a round of applause?